Hi, everybody, and welcome. My name is Christina Fuß, and I would like to welcome you to today's Grand Rounds. It is my particular pleasure to introduce our speaker today, Dr. Brad Johnson. Dr. Johnson is a professor in the Department of Ethics and Law at the U.S. Naval Academy in Annapolis in Maryland, and he is also at the graduate school, a professor at the graduate school in education at Johns Hopkins University. In his free time, he's a best-selling author, and I had the great opportunity to meet him during one of the leadership courses that I attended several years back at Harvard Medical School for Women in Medicine, where he led multiple workshops on being an ally, and he's an outspoken he for she person, I should say. And it's fantastic to have him here today. He will be talking to us about leveraging better allyship for gender equity in academic medicine. It will be a bit of an interactive lecture, and I'm very excited to welcome Dr. Johnson.
Thank you, Dr. Fuß. Appreciate it. Well, great to be with all of you. I will just let you know that Dr. Fuß tried to make this work, I think 3-4 years ago now, right at the beginning of the pandemic. So I actually flew all the way to Portland, Oregon, to do something for her at Oregon Health Sciences, and then the pandemic struck and it was canceled right after I landed. So I went to the Oregon coast for a week and did some writing, and it turned out to be a blast for me. But great to be with all of you. I know some of you are virtual. We are going to kind of make this active. I'm going to save some time for some engagement with all of you. Just for some context, I've spent as a clinical psychologist most of my career researching, mentoring, sponsoring relationships, and have always been interested in what do great mentors do from the perspective of mentees. What do they say they really value? And then about 12 years ago, one of my colleagues came along who was a sociologist. All his work was in gender work and family. And we began having these conversations about why don't men engage quite so much in the workplace in relationships with women, maybe mentoring, maybe just good collegial friendships. What can keep men on the sidelines? And then what does it look like when men show up as allies from the perspective of women? So I will let you know, I am not going to spend the next 45 minutes mansplaining what women need in the workplace. All of our research involves going out and interviewing women, and we actually ask some very behavioral questions. What does it look like to you when men show up as terrific allies? What are the behaviors you appreciate? What do you wish men would do more of? And we want to give this away to men so we can all be better. So I'm going to jump in, and I'm going to start with this. This is really what better male allyship for gender equity doesn't look like. This is kind of that siloed behavior where we get together and decide what are we going to do for women. This lands the wrong way often, right? It comes across as rescuing or white knighting, really the wrong message. And I think everything you're going to hear from me today has more to do with collaboration and partnership, and maybe the overall message of how do we go there together when it comes to equity. I'm not going to belabor this. I just have to tell you, at this point, the data on what happens in your organization when you have more representation around gender and other diversity is just off the charts. It's sort of, if this was law, we would say this is settled law now. It's not even a question what happens. You, as an organization, make better decisions. You're more creative. If you're measuring a bottom line somehow, you just do better in terms of income and outcomes. Organizations that have not just token representation of women, but women integrated all the way up into the C-suite at every level, they just perform better. So A lot in this for us as an organization, certainly true in healthcare and medicine. As we get to better representation, we're just going to be more effective. And now the data is actually causal. We can actually show when you have more women in senior leadership positions, you're actually going to have better outcomes, and we can show the cause and effect. So how are we doing in academic medicine? I'm guessing this won't be a huge surprise for a lot of you. We're doing well when it comes to med school. And after that, you kind of see the leaky pipeline if we're talking about elevating women into meaningful leadership roles. And I think often when majority men who look like me see this data, we often come back right away with, well, you know why that is, don't you? Women, they just want to step away and have children. Well, interview women who are leaving your organization, and you're going to hear something very different. Nope, that's not why I'm leaving. I'm leaving because I don't see a way forward here. This doesn't feel like a place where I see other women at all in any kind of leadership. I don't feel valued, and so I'm going to go somewhere else where I can do that. And by the way, also do caregiving. But there are a lot of junior men who also want to do caregiving and work. And if your workplace isn't allowing that, facilitating it, you're going to lose junior talent. So why do I talk about men when it comes to gender equity? This is just one of many large studies that kind of gets to this point. This was a huge study by Boston Consulting a few years ago, going out across thousands of workplaces and asking thousands of women questions about how they see gender diversity in their organization. And one of the questions I asked is your organization making real progress on the inclusion, the diversity around gender? What you see here is the number one predictor of whether women said yes or no to that was whether or not they saw men in their organization actively championing gender diversity, engaging as allies. When that was the case, 96% of women said, yep, we're moving forward. I see the progress, versus only 30% if they just didn't see their male colleagues engaging. So we need to be at the table. I think that much is really clear. My messaging today is really going to have more to do with gender equity and how men can show up as allies. But let me just tell you right now, if you get allyship right around gender, you can apply these skills to any marginalized group. And these are the three big buckets we find across all the allyship research. We certainly find it in ours. Three big things that the minoritized folks that you work with, maybe we're talking about women, say they must appreciate. So first of all, the interpersonal. How do you show up and hold yourself accountable in relationships? This goes to collegiality. It goes to starting trusting relationships. It goes to mentoring. Do you show up that way and hold yourself accountable? Then the public. This gets harder. Now I got to put some real skin in the game. Men will tell us this is more challenging. I got to call out bias and sexism in real time. I have to hold other men accountable. I have to loudly champion women for promotion. This puts me out there, and it can make me feel a little more uncomfortable. And then finally, we can get to systemic, where, hey, now I'm not just holding self and others accountable. I'm holding my organization, maybe my medical school, accountable for doing it the right way around how we treat people. What are our procedures? What are our policies? Are they equal? And if not, I call it out. I ask questions. It might be uncomfortable for leaders to hear. I want to say something about this. You know, sometimes my colleague, co-author Dave, are out doing workshops with men about how to be better allies. And sometimes men will come up to us and say, hey, when do I get my certificate? When do I get my, my credential as an ally? And we have to say, that doesn't happen. You don't really get one of those. This is a journey. We're always trying to get better. None of us really reach the finish line here. We want to welcome majority folks in, no matter where they are on the continuum. I got to tell you, I just don't encounter a lot of men who are just flat out apathetic anymore. I just don't see it, or those men don't speak up. They wouldn't come to an event like today. these would be men who just could care less about gender equity. More of us are somewhere else, right? Maybe I'm aware there are disparities. I'm not really sure what my role might be, but I'm open to hearing about that. Other men are kind of leaning in. They're a little more active. They not only come to an event like this, but then they start self-educating, they start checking in with women they work with, they start noticing inequities. And then finally, you get people that are on the advocacy end. Just remember, even if I can make it to the advocacy end around gender, I may be somewhere very different around race or LGBTQ identities. We're all on the continuum somewhere. So let's welcome everybody in to the conversation. I mentioned that these ally behaviors are really gateway skills. If you can master this around gender, it's going to make you better with any traditionally minoritized person that you might be working with. And this is just one illustration, women at the intersections, race and gender. This is some of the data from the most recent McKinsey study of women in the workplace. And you just find women of color have very different experiences than their white female colleagues in the workplace. They're not equivalent, much more likely to feel invisible, overlooked, working twice as hard to get half as far. And, as an aspiring ally, I want to acknowledge this. Women are not a monolith, and I've got a lot to learn about intersecting identities. So want to just tell you, this is a recent study of I find this really interesting. Men and women in the same organizations, they ask, do you see men showing up with some of these very specific micro ally behaviors? And I think what you see here is that men are more likely to say, oh yeah, men are doing that. We're supporting women in all these tactical ways. And then they ask women, and women are saying, I don't know where you work, brother, but you don't work here. I don't see this. I'm not sure what you're talking about. So I think a message for all of us is having intent, good intent. I believe in gender equity, doesn't get you to the actual tactical behaviors. So recognize I've got to go a bit farther than intent and get into these behaviors. So let me address this. Years ago, when Dave and I started our work on what allyship looks like, there were so many reasons why men stayed on the sidelines. And I don't know what it's like in Yale Radiology. I notice a lot of men in the audience, so kudos for being here. I don't see as many women. And so a question might be, as somebody who might identify as a male, what keeps you on the sidelines when it comes to really engaging with your female colleagues, mentoring women, leaning into relationships with people who identify differently around gender? Are there things that keep you on the sidelines? So I'll give you a thumbnail of what we found. Men will tell you, yeah, anxiety. I don't want to step in it. Don't want to say the wrong thing. Don't want to make it awkward. So I stay on the sidelines. Maybe rumors. If I start mentoring a junior woman, will people start talking, right? There's something going on. So I don't want to deal with that. Maybe I've got implicit bias. There's this women are wonderful effect in psychology. Ask men, what do you think of women? They'll say, oh, women are great. Love women. They're caring. They're kind. But you don't hear the agentic leadership language, which may mean that I'm not offering her mentoring or sponsoring. I just don't see her as a future leader. And then Me Too comes along, right? And we're looking at all the research post Me Too. About 60% of men in America were saying, yeah, I'm sorry, I'm not mentoring women. It's too dangerous, too dicey. It's not safe. A lot of false narratives around Me Too, right? Me Too is pretty straightforward. Women would love to come to work and not be assaulted or harassed. Super low bar for dudes to get over. But instead of that, you hear the false narratives. It's just not safe. So I think as a clinical psychologist, I spend a lot of my time reminding men, if you have anxiety about anything, there's only one treatment, actually, evidence-based treatment. It's called exposure therapy. More engagement, more conversation, more lunches, more mentoring. That's really the only way I address that. Finally, one narrative I do hear, and I don't know if you ever hear it here, but I'll hear men in confidential moments say, I would mentor a junior woman, but what if she was attractive? Wouldn't that be awkward? And I have to just say, no, not really. But if you do hear that narrative, there is something brand new. And because you're a radiology audience, I'm going to go ahead and share some cutting edge stuff with you. I don't want to trigger anyone, but here it is. Turns out men have a frontal lobe. And, you know, the beauty of this, I can be aware, someone who knew, I can be aware someone's attractive and have judgment, impulse control, good decision making. I share this with some intended humor, but I think there's a kernel of truth here. One other thing that you can share with people, if you do hear the attraction thing, there's this great research in social psych where they'll go into a workplace like yours, and it's called perceived mutual attraction research, and they'll have you anonymously rate everyone you work with. To what extent do I find them attractive? And then there's another column where you have to anonymously rate, well, to what extent do I think each of those people find me attractive? And it turns out one gender consistently overestimates that second column. So, so message to us men, she's really not that into you. So more reason to keep it professional. I want to talk about this. I'm following some interesting research in the last decade on men who are getting promoted to C-suite leadership jobs. And an interesting change is happening. The things that would have gotten your father or your grandfather promoted in the workplace, probably not going to work for you anymore. Men who are getting promoted today have a different suite of behaviors. You can see a lot of them here. They kind of fall under the broad umbrella of emotional intelligence. So showing up with humility, authenticity, curiosity, a bias for inclusion. These are the gentlemen who are getting promoted. Ironically, women have been doing more of these things for a long time. We're sort of catching up. But I think this is an interesting opportunity if we're talking about allyship, making this part of your leadership brand, probably going to be really good for you. So I want to get into the tactics. I want to share with you some best of with our remaining time and then have some Q&A with you. It's usually right about this point. You know, we've made the case for this. We've talked about why does it matter? And I can see men maybe kind of getting fired up and motivated, ready to throw on my ally cape and go charging into the workplace at Yale here. And then we have to say, well, hold up, gentlemen. Actually, allyship has got to start here. And let me give you some context for that. Here we are, year 2024, looking at research on heterosexual dual career couples, both working full-time. Chances are really good she is doing double, at least, of the domestic work, the childcare, everything that goes into running a home. Men are not really leaning in at home. Even if they have somewhat egalitarian relationships, they're often not carrying their full load. And this is why the World Bank estimates, you know, on our current trajectory, we've got about 200 years to close the gender wage gap. 200 years. A big part of the contribution is this. If it shouldn't shock us if we're not promoting more women, if we have a pay disparity, part of the contribution is men are not leaning in here. So if you identify as a male today, I've got a challenge, throwing down a challenge for you. If you're partnered with a woman, go home today and check in with your partner and ask, am I really showing up as an ally in our relationship? If you're not, when you get that feedback, don't get defensive. Just think about, all right, how can I up my game? And this is not just doing the dishes. This is doing all of that hidden cognitive emotional labor that tends to default to women in relationships. So, you know, keeping lists, planning events, knowing your children's clothing size. This is where we got to step in. And by the way, you know, in all the research we are doing, we find not enough senior men doing what I call leaving loudly, meaning, do you normalize caregiving? Do you normalize the caregiving part of your own identity as a male in leadership? If you're not doing this, if when you have to go take your child to something, or you've got to stay home for a family obligation, you skulk out the back door, keep it hush hush, you're not doing a service to your organization. If you role model leaving loudly, hey, I won't be here, I'm sorry, I've got to go take my child to a sick thing, or I've got to be at a parent teacher conference. If you talk about that, you normalize it for everyone, especially the junior folks that are watching you. You somehow level the playing field through your behavior. So role model this, talk about it loudly. You change the culture when you do that. All right, so I'm going to go ahead and get into some of my favorite interpersonal tactics. So if you are an aspiring ally in the audience, remember, you can apply this across gender, but you can apply it to any group that tends to be marginalized in the workplace. Many of these tactics, I think, are going to map nicely. So number one, build your gender intelligence, do some self-education, come to events like this. There's so many podcasts, there's so much good reading on gendered headwinds that women encounter in the workplace. So if you're not a woman, don't identify that way, learn, self-educate. And then once you've done the work on your own, reach out to women you work with and just ask curious questions. Hey, I've been reading about blank. I wonder, would you be comfortable sharing some of what you've encountered here? Is any of this happening here? And I'm just not aware of it because it doesn't happen to me. Ask to ask, would you feel comfortable sharing? That gives her the decision. It's up to her whether she wants to share that, but it's a way to start opening your eyes to gendered headwinds that may be affecting women that you care about and work with. Here's something just the last year. I thought this was a great example of things that maybe as a majority male, I would never see. It wouldn't happen to me. Here's the tallest poppy study just came out this last year showing that women who outperform others in the workplace, women who identify as being ambitious, what happens to them? Well, they get undermined, right? They get chopped off at the knees. Men undermine women who come across as high talent and ambitious, but other women can do this too. So do you notice this when it happens? When women are rocking it in your workplace, do you support them? Do you call out their great work? Or do you see them being undermined and pushed to the curve? Notice this. I got to pay attention to this when it happens. Great opportunity to show up as an ally. Here's another thing great allies do. I solicit, I'm interested in feedback. When somebody trusts me enough to come to me and say, hey, Brad, when you said that, nah, don't do that. It was cringeworthy. It came across the wrong way. I better be ready to receive it. And often when we're not ready to receive it, we can respond defensively. So we got to be careful about that. I need to welcome this and then share it with others. Hey, I stepped in it. Here's what I did. Here's what I learned from that because somebody gave me feedback. I'm sharing it with you because maybe it'll help you not step in it the way I did. So this is how you create a community of allies. You share it when you don't get it quite right. I'll give you an illustration. First book, my co-author and I were writing in this space was about men mentoring across gender, mentoring women. And, our working title was not the final title. The final title was Athena Rising, which I thought was a very affirming kind of title. Our working title was Guiding Athena. All right. And guiding's kind of a synonym with mentoring. We thought it was an awesome title. Our publisher came to us, shortly before publication and said, hey, guys, can we talk to you about that title? And we said, yeah, we love it. Have you thought about guiding and how that's going to land with women, right? That they need to be guided by a couple of men. And we thought, oh, no, we didn't think of that. And thank you for saving us from an epic fail. So we share these learning moments because they're going to happen to all of us. Any idea what the number one thing women tell us in our research that they wish men would do more of? It's this. Until we started this research, I had no idea that men struggle quite so much with generous listening, spacious listening. Women say, yeah, he'll listen just long enough to maybe hear a problem, and then he's trying to fix me or fix my problem. Really not what I need. I would just love a sounding board, somebody who shows up with a bias toward hearing what I have to say and not presuming that they need to fix it. I can also watch assumptions. One of the people we got to interview was Janet Petro, who runs the Kennedy Space Center. And during the interview, she raved about her mentor, Robert Lightfoot. He was kind enough to give us an interview, and he was director of NASA at the time. And he was refreshingly humble. And he said, gentlemen, let me just tell you where I got it wrong. in my relationships with women earlier in my career, I would make assumptions about what they wanted or didn't want because they were women. He said, here's an example. I was on a committee to hire for a major executive position at NASA. By far, our top candidate was a woman. In that final meeting, before we offered the job, I wanted to show how gender savvy I was. So I said, you know, this job involves a lot of travel. And she just had a baby. I don't know. He said, fortunately, a woman was sitting across from me with daggers coming from her eyes. And she said, Robert, I think she knows the job involves travel. I'm certain she knows she had a baby. So how about if she's our candidate, you don't decide for her? And he said, that seems so obvious now, but at the time I was missing it, right? That was kind of my light bulb moment. Don't assume, actually check in with her in terms of where she would like to go. I mentioned the feedback. Here are some kind of immediate responses to feedback. If you're somebody who is going to get feedback from an underrepresented person, this is the way you want to respond. I guarantee you, if you come back with some of these, you're going to get more of that. And that's what we all want. We need it as an ally. Too often, though, in the research I do, interviewing women, you get something very, very different. So she shares with a male colleague, maybe some harassment, or maybe some, really inappropriate sexism in the workplace. And the first thing out of his mouth is one of these things, right? These are just kind of classic gaslighting comments. How common are these, right? But they're all designed to make the person question their sanity or their perception or believe they're blowing it out of proportion. This is going on way too much, and I need to notice it when I see it. How different is it to respond to her with something like, I believe you? Could you tell me more about what happened? And I know you don't need me to rescue you, but how can I collaborate with you so this doesn't continue? Really different kind of response. How about your situational awareness? This is part of your GQ, your gender awareness. Are you aware of dynamics in places like meetings? How ubiquitous are some of the aggressions, some of the sexism that happens for women, some of the headwinds in your typical meeting? I'm guessing here at Yale too. So there's some things I can be aware of. Who got invited to the meeting? Who didn't? Who should be in this meeting that's not? Why are we talking about her area of specialty when she's not even here? Who's got a seat at the table? Who's getting interrupted 3 times more than somebody else? Who's having an opportunity to speak and who's not? And then who's having their ideas actually respected and valued and amplified, and who's having their ideas stolen? I had no idea until we started doing these interviews how common it is for women to have this experience. They have a great idea, they share it with their team, everyone's like, man. And then maybe 20 minutes later, some guy says almost the same thing, and everyone's like, wow, great idea, Brad. I hadn't heard that because I don't experience it as a male. It doesn't happen to me. But for women, they actually have language for this. They call it bropropriation or heap-eating or imitating. Apparently, it is quite common. So I can notice this. I can be aware of it. Let's talk about mentoring real quickly. A lot of men will ask me, why do we have to mentor women? Why can't women mentor other women? And the answer to that is women do. Women do mentor other women. There just aren't enough. Think of Yale Radiology. Look at the chain of command and the faculty. How many senior women in leadership do you have? If you expect those few women who have made it to the top to mentor all the junior talent, happens to be women coming through the door, it's not fair. They'd never get promoted again because they're spending all their time doing this extra unpaid labor mentoring. So men need to lean in here. We find in the research that when women have male mentors, they actually make more money and go farther, not because men are better mentors. We often hold more rank and power. We can open more doors. So there's really no downside here for us. I will tell you, in medicine, this is a huge challenge. Lots of different studies on the experiences of gender around mentoring. And I can just tell you, women don't encounter it much. And they certainly don't encounter loud sponsorship as much as men do. Women will tell you, though, it's not just mentoring, it's a kind of mentoring. women will say, I'm not interested in this hierarchical top down. He's on broadcast mode, just telling me how to do my career, maybe trying to clone me in his image. No, I'm interested in something much more reciprocal, much more collaborative, mutual learning. That's really much more appealing to me. So I want to focus on the kind of mentoring I'm doing. I also want to just call out the best mentors are always doing this. I realize in a humble way, there's a lot I don't know. So when she asks me a question I don't know the answer to, I don't make one up. I just say, hey, I don't know, but let me introduce you to maybe a couple different people that I think might know because they have more experience than me. And part of what I'm doing here is deliberately building your network because I know you're going to go farther in your career if you're better connected. So let me be your great connector as your mentor. So final thing before we get to a few public things as we're wrapping up, I see men getting hung up here. I hear men, they'll share it with me frequently. Yes, I see these talented junior women, maybe at Yale Radiology. I know I should offer some mentoring. I'm not sure how to do it. And I don't want it to be awkward. So I stay on the sidelines, right? I think we men make this more challenging than it needs to be. So I'm just going to do actually a demo. Dr. Foos, could I get you to help me out with just a quick demo here? I'm going to try, she's this talented lady, just for the fictitious piece here. She's junior to me. And I would like to offer mentoring. So let me try this one. Hey, Christina, I'd like to mentor you. I mean, don't ever do that, ever. Don't ever use your creepy voice. And then there's more Dr. Foos, no context. Like, what is he talking about? So let me try to do it. Hey, Christina, I saw you give that presentation last week. I thought it was terrific. I was thinking, wow, we were lucky to hire you here. I hope we can keep you on board here at Yale. If you ever want to just drop by and chat about next steps in your career and how I can contribute, I got an open door. Feel free to drop by. I hope that was better. Okay. Thank you. I think what you see is not that hard. That was not a heavy lift. I was able to sneak in some affirmation of what I already admire about her. And now it's up to her. I'm not going to stalk her. I've offered, and now it's up to her, right? And most people I know are probably going to drop by sometime, and that's great, but it's not hard to have that initiatory conversation. Okay. With the remaining time, this is going to get into the challenging stuff now. We're going to put some skin in the game when it comes to allyship. This is where, again, men say, this makes me a little uncomfortable. And part of our challenge is to get uncomfortable with allyship that's a bit more public. So I want to start here. Actually, I'm going to give you a scenario first. Here's a scenario. You're in a meeting here at Yale, and there are a couple of guys talking before the meeting begins. You can hear them. One guy says, I wonder why we don't have more senior women here at Yale Radiology. And the other guy says, well, you know why that is. Women just don't want to work as hard. Boom. There it is. That just landed on the table in the meeting. Everyone heard it. What would you do? Think to yourself, little thought experiment. What would you actually do? Okay. And now let me tell you what the research tells us you're likely to do, and that's nothing, right? The bystander research says that within about 3 seconds, something called bystander paralysis sets in. That comment disturbed me, but I'm probably after 2 or 3 seconds not going to do anything about it. And then later, I'll leave the meeting kicking myself, thinking, oh, I could have said this. I wish I would have said something. It affected everyone in the meeting, but it's too late now, right? I missed the opportunity. So I have something called a 2-second rule. Within 2 seconds of that biased sexist comment landing on the table, I need to say something. And if I'm not sure what to say, how about a simple disruptor like ouch? Right? The beauty of something like that, it's kind of awkward, but it buys you a few more seconds while everyone in the room looks at you like, what's your thing? And it's going to then let me articulate what's not okay with me. So I actually want everyone in the room to practice the ouch technique just for about 30 seconds. And I've got a co-conspirator here. So JC, would you come on? Okay. So JC and I are just two guys, two dudes here at Yale, and you're going into a meeting. Oh, we need to get closer. I'm sorry. If you come over here, JC. Yeah. Yeah, I think we can just stand here. Is that okay? Okay. How's that? Can you hear me? Okay. All right, I'm just going to hold this here, JC. And so you're coming into the meeting. These are two guys. We're having a sidebar. If you hear something that doesn't land the right way with you, I should hear some loud ouching going on in here. All right. Hey, JC, I was in that meeting the other day. That new person you hired, Shonda, she's amazing. She gave a great talk. Yeah,
Yeah,
dude, I was thinking if you're mentoring her, one thing she could do more is smile. I mean, right? She doesn't.
man.
Yeah, she should smile more. She comes across as a little abrasive, you know what I mean? Yeah, I was thinking someone that talented, I'd like to get over on in my shop. Now there's a lot of international travel. Is she married? Do you know? Okay. Yeah, okay. Oh, too bad. One last thing though. I mean, between you and me, she's easy on the eyes, right? Okay. That, okay, thank you, Jay. And by the way, he's not that kind of dude. I put him up to that. Just want you to know that. So I think you just demonstrated how easy it is to do the ouch. Now, here's the problem. That may sound hard to you to call it out in the meeting. I have to tell you, I think that's the easy part because then I see too often men will follow that up with, hey, man, there are women in the room. You can't talk that way. Have you heard that kind of thing? Friends, that's not allyship. That's not allyship. You need to own it. You need to make it clear to everyone that your discomfort is not because of the underrepresented person in the room. It's because it didn't land the right way with you. And I think you need to have some own it statements kind of queued up. Here's some that I like, and these can just roll off my tongue because I've used them a lot. It can be something as simple as, hey, we don't do that here at Yale, or I didn't find that funny, or that sounds like an outdated stereotype, whatever. Just call it out, but attribute your discomfort to yourself, not somebody else. Now, here's a final thing, and I think some of you were probably wondering in that first scenario, well, who was the guy who said it, right? And maybe that affects my calculus a little bit. Do I call him out right there in the meeting, or do I go to him maybe in private? And I don't know that there's always a right and wrong answer. Let me just tell you this. If what was said was egregiously sexist, if what was said is going to affect the morale of your whole team, you don't have an option. You're going to call it out right there. You don't wait. If you are silent when something like that happens, it communicates to everyone that that was okay. You give tacit approval. But there are a lot of other situations where the guy has no idea that what he said was off base, or he's from a different generation, maybe a culture that might frame that differently. Okay, so here's an opportunity for me to go to him, close the door, and in a spirit of what I call carefrontation, just say, hey, brother, no. When you did that today, a lot of people in the room cringed. Let me explain why. And you got to get better. You've got to improve your brand as a leader because that's going to not land well here. So I share this with you because I care about you. But if you do it again in a meeting, I'm going to call it out. I think that's fine. But I think we all need to make that calculus. Let me just tell you this. If you start doing this, if you start calling things out, if you start holding other men accountable, people are going to come to you and say, hey, what's your thing? Why are you so into this gender thing all of a sudden? And I think you need to be ready with what I call your why. You need to be comfortable sharing why this matters to you. Maybe it's personal. Maybe there are women you care about in your personal life. I've heard men say, hey, stuff like this has happened to my partner at work, and I think it's messed up, and I don't want it happening here at Yale. Just have your personal narrative. You can also have the business case. It's not good for us. It's not good for recruiting. It's not good for getting to more gender balance and leadership here. There's a lot of reasons why, and it's also, by the way, just the right thing to do morally. Here's another public tactic. Do you push back on secrecy? And this is always the part that makes lawyers and HR folks uncomfortable. But let me just tell you, I mentioned the gender pay gap. Part of the reason we have that is that salaries, benefits, all of the reward structure tends to be shrouded in secrecy. Nobody knows how much different people are making. Women have no idea what the right salary to negotiate might be because people don't share that intel with them often in that first job interview. I need to push back on this. I need to be transparent. I need to share my salary, for example. Have a salary reveal party among the residents or the faculty here at Yale, but don't allow secrecy to allow people to be mystified about what they should be asking for. Let me give you an illustration of this. We got to interview Hideko Serra, who was a faculty member at a university in California. She said, I got hired at exactly the same time as a male. For about 5-6 years, we got tenured. We produced almost identical CVs in terms of publications. We had the same teaching evaluations. Then we shared a dean job for 5 years. And after we were done with that, the president of this university wanted to thank us as we went back to the faculty by giving us a little pay bump. And he wanted to meet with us individually. My male colleague found out when my meeting with the president was and deliberately scheduled his for the day before. He then came to my office with a piece of paper and handed it to me and said, Hideko, I want you to see this because I have a bad feeling that as a woman, you're going to get lowball. This is what the president offered me. If he offers you more, great, but don't you dare take less. It wouldn't be fair. And she goes in the next day and gets offered, 20,000 less than her male colleague. And she was able to show the paper, and the college president blinked and immediately raised her salary. That's allyship. You push back on secrecy. I want to say something about sponsorship. This is Sheryl Sandberg, recently of Meta. Dave and I have been lucky to interview her for both of our books. This was her main message for men when it came to mentorship. If you're mentoring a woman, it is not enough to be nice to her. Women get too much of the nice stuff. What they don't get, excuse me, is the loud sponsorship. She said, let me tell you what that looks like. This is my first job out of college. I was a primary assistant to the Secretary of the US Treasury. Everywhere we went on the world stage, he would introduce me to each new leader. Hey, this is Sheryl Sandberg. She's a rock star, graduated #1 in economics from Harvard. I couldn't do my job without her. He would just rave. And she actually pulled him aside and said, Larry, that's embarrassing. You need to stop that. And he said, Sheryl, this is how things take off for you. This is sponsoring. You've got to let me do this. And so I think litmus tests for us men, are you talking about her while she's not even in the room? Are you her raving fan? Especially these high talent colleagues you are who aren't getting enough of this to begin with. This is how we get to more gender parity in leadership. We've got to be loud sponsors, not just mentors. So think about people you might be promoting, mentoring. Do they all look like you? And do you have an opportunity to diversify that a bit and become a loud champion for somebody else? Here's another tactic. I call it decentering. How often is somebody like me, an older white guy in a meeting, and I'm not the leader, I'm not the subject matter expert, but at the beginning of the meeting, everyone looks at me and just kind of assumes I'm probably going to kick it off, right? And I have an opportunity here every time that happens to say, hey, I'd love to share my thoughts, but the person that should be talking here is Tanya. She's the subject matter expert. I really want to hear what she has to say. That's not a heavy lift. Give her the mic, lateral pass, make sure the person who should be speaking is the one speaking in the meeting. All right, I want to wrap this up by talking just a little bit about the systemic. And what can we do on the systemic level? And I want to talk about the leadership tightrope just briefly. There are so many headwinds for women around leadership and things that I don't experience as a male. I can show up any way I want in terms of my leadership brand, and people probably think that's good leadership. Women, not so much, right? A little too much of the agentic, traditionally masculine. She gets labeled with your favorite B word. Not enough of that. She gets labeled as inadequate or not a good leader. So I want to pay attention to that. And you may be asking, well, where does this really play out? Well, here's where it plays out. One of the places, subjective annual evaluations that might lead to pay increases. This is a huge study of 80,000 of those. Look at the language difference for men and women in terms of frequency of words that get applied to them in subjective evaluations. And you might wonder, well, where does this really play out? Well, it does. It plays out. Look at the words, the positive words. Not only do women get a lot more negative, but there's a difference in the positive language. Women, compassionate, men more likely to get analytical. Well, if you can only hire one person, who are you going to hire? And it's often the analytical, right? Or you're going to promote that person to leadership. So I would love to be both compassionate and analytical, but it's going to make a difference. So notice this kind of thing. So here are kind of some wrap-up things that you can be thinking about. These are some best practices around allyship we see. Number one, we do need to invite men in to the conversation. So, if we have a women's network at Yale, do you have some joint programming with men? Do you let them know, no, this is not just a women's thing. This is for you as well. And let's invite them into the conversation. Men will actually tell you, I would have gone to that, but I didn't think it was for me. I thought it was just for women. Are you transparent as an organization around your objectives? In Yale Radiology, where do you want to be in 2030 when it comes to representation and leadership? Are you clear about that? Are you transparent? Where could I go find that on your webpage? Where you want to, what are your 2030 targets around improving representation? If I can't find that, I'm concerned. And then, do you track how you're doing? Do you collect data? Do you actually come back on your website and say, hey, here we are, we have work to do. We're not making the progress we want, so we're going to up our game and we're going to try some different tactics. And then we need to build it into the processes. So here's just one illustration of where you might see this happening. COVID, I don't know if you saw this massive study from science publisher Elsevier journals looking at who submitted manuscripts during the couple of years of the pandemic. And you see this massive delta between men and women compared to pre-pandemic submissions of papers. Men's submissions actually went up, women's declined. And, back to the caregiving disparity, maybe it shouldn't be a big surprise to us, but the pandemic was actually good for men in some ways in terms of productivity, not our female colleagues. So how do we as an institution mitigate this? Do we pause tenure clocks? Do we pause other kinds of promotion milestones? If you're not doing that, if you're not taking some bold action, it's a setup for undermining your efforts around getting to representation. And then last place you might, and I'll just offer this, how many of you are on search committees or residence selection committees? How often do you hear language like this creep in? I'm not sure she's likable. What do you mean by that? Are we giving a standardized measure of likability? Are you somebody who would call that out when you hear it? Same with things like she's a busy mom for junior faculty. How does her parenting status have anything to do with whether or not we should be hiring this person? So are you calling it out when you see it? Last two things, and then I want to see what's on your mind as we wrap up. I've mentioned let's call more men into the conversation, and I see women's organizations doing more of this, like women's conferences, maybe in medicine. They're going to have subtracks they'll call like manbassadors or male champions, hoping to recruit more men. And, in truth, men will see that and they'll say, yeah, I'm a champion, I'll go to that. But women understandably can roll their eyes and say, really, I got to call you a champion just to get you interested in equity and fairness. So I think you see the problem here. We got to show up with some humility. We have to show up without presumption and recognize, especially as men showing up in these spaces, our job is to listen and learn. And then last, I've just been telling you how great allyship is and why you should all lean into it. But let me just also offer the caveat, don't call yourself one. That never lands the right way. Don't presume that anyone sees you as an ally. And this is not just for women, it's for any underrepresented group. Do the work. Show up and be a better colleague and ally. And then if someone calls you an ally, great. You should feel good about that. But remember, you're only an ally to her, not to all women or people who identify that way. So I'm going to stop and just see what's on your mind.